For today's discussion, I am going to discuss the theory of Joyce Travelbee, which is human-to-human relationship model. So let's start. Human-to-human relationship theory. A nurse does not only seek to alleviate physical pain or render physical care, she ministers to the whole person. The existence of the suffering, whether physical, mental, or spiritual, is the proper concern of the nurse. So, in this theory, she defines nurse as someone who has the responsibility to aid the sufferings of individual, not just physically, but as a whole human being. Kumbaga, suffering is the main problem of a nurse in this theory. On how can be a nurse make themselves as an effective educator to educate the patients about the existing suffering. So, before anything else, let's take a look at her background. She is a psychiatric nurse, educator, and writer born in 1926. In 1956, she completed her BSN degree at Louisiana State University, whereas in 1959, she completed her Master of Science degree in nursing at Yale University. In 1952, she worked as a psychiatric nursing instructor at DePaul Hospital Affiliate School in New Orleans. Later, in Charity Hospital School of Nursing in Louisiana State University, New York University, and University of Mississippi. In 1970, she works as the project director of graduate education at Louisiana State University School of Nursing until her death. Travelbee died at the age of 47. So, ayun nga, as you notice, nagamit niya yung pagiging nurse niya in different hospitals sa US. She also started doctoral program in 1973. Unfortunately, she was not able to finish it because she died later that year. She passed away at the prime age of 47 after a sickness. So, moving on sa ating paksa sa kanyang theory. So, human-to-human relationship model of nursing. Joyce Travelbee, 1926 to 1973, developed the human-to-human relationship model presented in her book Interpersonal Aspect of Nursing, 1966-1971. In 1969, when she published her second book, Intervention in Psychiatric Nursing, Process in One-to-One Relationship. So dito, she explains that the purpose of nursing is to establish human-to-human relationship and to provide care and further know what is the root of the sufferings of a patient. So ayun lang po yun. Human-to-human relationship is building connection to your patient as a human being then. The development of theory. Travelbee based the assumptions of her theory on the concepts of existentialism by Soren Kierkegaard and logotherapy by Viktor Frankl. Existential theory believes that humans are constantly face choice and conflicts and is accountable to the choices we make in life. So dito, parang sinasabi lang na we suffer because we exist. Existentialism believes that people has a freedom to choose what actions he or she will do, and he or she also suffers from his or her decisions. So other theoretical sources of Joyce Travelbee includes this logotherapy. Logotherapy theory was first proposed by Viktor Frankl in his book Man's Search for Meaning in 1963. So itong logotherapy is a meaning-centered psychotherapy based on the assumption that meaning, fulfillment in life is the best protection against emotional instability. So paano ina-apply sa pasyente? This is where a patient is actually confronted with and oriented toward the meaning of his life. Kumbaga, pinaiintindi sa pasyente kung ano ang kahalagahan ng buhay. So, another inspiration of Travelbee in her theory was her former mentor. So, trivia. It was Ida Jean Orlando who proposes the deliberative nursing process. As you can see and analyze, their theory has some similarities, particularly on their definition on how to assist patient. Meeting their need is through common humanity. Same siya sa theory ni Orlando. Sabi doon, nursing role is to discover and meet the patient's immediate need for help. Itong kay Travelbee naman is to find meaning in these experiences. So moving on, the human-to-human relationship model of nursing has assumptions. One of the assumptions is she dealt with the interpersonal aspect of nursing, focusing especially on mental health. Sa interpersonal aspect of nursing, nandun yung communicating, listening, developing trust, and obtain data. So, we ask patient about his or her feelings as part of communication, and then we listen on his or her reasonings and everything he or she will tell. From that, we can develop trust and further obtain data, which is needed in finding the sufferings. So, interpersonal meaning is to interact with patient. Sabi dito, focusing especially on mental health because it is hard to treat illnesses when our emotions are the target because we as human are parang close sometimes for suggestion lalo't nandun tayo sa higher emotion. Like if the patient is in anger stage, how can you apply your interpersonal skills if sa una pa lang ayaw niya ng kausap? Diba mahirap? Mahirap in the aspect na mahirap i-measure yung pain or suffering ng patient when it comes to mental health dahil we have different approaches sa pain. And to know it is to have this human-to-human relationship para makarelate ka as a human to the patient. So, another assumption, she explains human-to-human relationship is the means through which the purpose of nursing is fulfilled. Travelbee firmly believes that as a nurse, building a relationship which is humanistic is the central of satisfaction on this field. Kumbaga, the ability of nurse to effectively apply what he or she learns in nursing school fulfills his or her purpose as a nurse. So, sa pamamagitan ng human-to-human relationship, ma-apply mo yung nursing process or yung deliberative nursing theory ni Ms. Orlando, yung assessment, diagnosis, planning, implementation, at evaluation. You can now know if you have successfully achieved your goal as a nurse, which is to aid the suffering. Another assumption, inspired by being a psychiatric nurse, she struggles for humanistic revolution with devotion on caring and compassion for patients. So, as a psychiatric nurse, we all know that it is more on mental illness or disabilities. So, itong si Travelbee, very much alam niya kung paano or how to handle patient in psychological aspect. Devotion on caring and compassion for patient is what she is marking on this assumption. To devote on your career through holistic care and to have compassion for patients. If you will remember our module on Funda, yung caring encounters, compassion is given as part of the caring relationship doon. As the nurse shares the client joys, pain, and accomplishments. Hindi lang dapat tayo sa joy ng paggaling, kundi dapat mas nandun tayo sa part ng pain as we try to find the sufferings. Compassion is a gift from the heart rather than an advanced skill or technique. Last assumption, she stated that every human being suffers because he is human being and suffering is an intrinsic aspect of human condition. Sabi doon, why do people suffer? It is a universal question, yet we all attribute its meaning personally. We all have this suffering every day, whether it's a minimal or extreme suffering. Because as a human, we all have expectation, diba? Kung saan, kapag hindi natin nakuha, we suffer from the consequences. According to this assumption, it is normal to have suffering because we are all human beings with weaknesses that forces us to act under the influence of our emotions. So, human-to-human relationship model of nursing has a purpose. Base dito, the nurse is responsible for educating and providing strategies to assist the patient in avoiding or alleviating the distress of unmet needs. So, dapat maging flexible. Flexible in assisting the patient kasi what if the patient will heal fast if he or she expresses her or his feelings freely? So, as a nurse, you should listen to the patients. For me, hindi na yung responsibilidad, kundi isa ng obligasyon. Kasi once the patient confesses her sufferings, you are now part of his recovery. And if the nurse ay merong the quality of being adaptive, and kung naiintindihan niya yung sufferings of patient, then the patient will be responsive dahil nakikita niya na this nurse is a caring one who wants to contribute on his or her recovery. Providing strategies to assist the patient through interaction pa rin ay sobrang essential. Sabi nga, diba, the nurse and the patient are human beings relating to each other. The process is that of interaction. At sabi rin, diba, nursing is an interpersonal connection whereby the nurse facilitates the progress of a patient, diba? So, paikot-ikot lang tayo. Itong human-to-human relationship model of nursing ay may several concepts which we need to understand as it is related to the theory. So, suffering. Suffering, which is an experience that varies in intensity, duration, and depth. A feeling of unease ranging from mild, transient mental, physical, or mental discomfort to extreme pain. So, as a nurse, we should know how to help patients cope their sufferings by means of what? By means of interviewing. Interview your patient in a manner that you are both comfortable to discuss the sufferings. Pero take note, we can't directly ask the patient, ano bang pinagdaraanan mo? Ano bang karamdaman mo? Abay, may pagkakataon na hindi ito applicable. Timing is also essential on this part. Kasi, for example, what if the patient, a girl patient, is in traumatic phase of her life, as she witnessed how her family being wiped out by a bombing scene, diba? So, the initial reaction of a patient in this scene is tulala. Like she feels more hurt on emotional than on a physical. Sometimes, observing is okay rin as a first step in building to human relationship. Di natin pwedeng agaran, itanong baka mas lumala pa ang sufferings. Remember, we are to aid the sufferings palagi because it is easy to identify her sufferings, but it is hard to justify kasi we don't know the feelings really. So, it is essential talaga to establish human-to-human relationship kasi the patient can look the nurse as a person who really cares as a human and not only as a health providers. Second concept, meaning. Describe as the reason attributed to a person. Dito, as a nurse, we should be observant. Meaning, simply means what is the reason ba of his or her sufferings. So, dapat meron tayong better understandings of human symptoms, burden, and illnesses para malaman natin kung ano nga yung ugat ng sufferings. So, given din sa concept ang nursing. Nursing, which helps a person find meaning in the experience of illness and suffering. Nurses contribute to the healing of a patient talaga, more than the treatment itself. Kasi before pa ibigay ang treatment, di ba assessment muna, where the nurses interact with the patient. So the nurse tries to pull off the reasons of the sufferings. Being present is a way of sharing in the meanings, feelings, and experiences of the client. Physical presence is combined with the promise of availability, especially during a time of need. So, paano magkakameron ng meaning yung suffering? It is through knowledge. It is gained by observing and talking with client and family while using effective listening and communication skills. So, yung mga nurses din ang nagbibigay na itong isang concept, which is hope. Hope is the faith that can and will be a change that would bring something better with it. So, there are 6 important characteristics of hope. Ito yung dependence on other people, future orientation, escape routes, the desire to complete a task or have an experience, confidence that others will be there when needed, and the acknowledgement of fears and moving forward towards its goal. Itong hope, ito daw yung mainstream ng human-to-human relationship, to give hope that every suffering is a way to better life, to avoid hopelessness. Diba, we have patient na talagang nawawalan na or they lose hope lalo't emergency situation. We, as a nurses, should be an active implementer of hope na kahit na in the end of the life na ang patient, we should give him faith na he will recover. So, another concept na given ay communication, which is a strict necessity for good nursing care. Sabi nga diba, communication is the key. Ganon din sa nursing. We should be good communicator to have this human-to-human relationship. So, ano nga bang purpose nito? Una, to obtain information, and pangalawa, to influence others. So these two purposes are considered to be effective. So, paano mo nga naman mamimit yung mutual understanding if communication isn't effective, diba? So, next, self-therapy, which is the ability to use one's own personality consciously and in full awareness in an attempt to establish relatedness and to structure nursing interventions. This refers to the nurse presence physically and psychologically. Itong self-therapy, make yourself an effective medicine to aid the suffering, lalo na sa may mga mental disorder. Ito'y lubhang mahalaga ngayon, lalo na ang depression ay sobrang alarming. So, dapat, we should be physically on the side of the patient, as much as possible, as much as kailangan. Kasi, di ba nga, sometimes, counseling is a treatment na, and very effective, and nurses are classified as counselor rin.
Targeted intellectual approach by the nurse toward the patient's situation. So here naman, how can you make use human-to-human relationship? How can you use your perceived knowledge into intellectual approach to treat the patient's sufferings? So critical thinking is needed to make this approach. Kumbaga, nandun na tayo sa planning, yung na-address na yung problem identified in the diagnosis. So, kailangan na lamang yung formulation of nursing care plan.
Nursing meta-paradigms. Person. Person is defined as a human being. Both the nurses and the patient are human beings, a unique irreplaceable individual. Sinabi rin ni Travelbee na, actually, there are no patients. There are only individual human beings in need of care, services, and assistance of other human beings. So, mahalagang maintindihan kung ano ang human being. So, according to Travelbee, the human being is a unique individual, natatangi, walang katulad. So, being different nga, human beings also have different suffering, which Travelbee wants to emphasize here. As we understand our human thing, we grow and develop more human consciousness. So, based pa rin kay Joyce Travelbee, there are no patient. Meron lang taong di kayang alagaan ng sarili and need ng assistance. Parang kay Orem lang na self-care deficit. She defined nursing as an act of assisting other in the provision of self-care. So, kagaya ng kay Travelbee, kailangan ng may taong aagapay sa taong hindi kayang alagaan ng sarili. Next meta-paradigm is health, composed of two categories, subjective health and objective health. Subjective health is an individually defined state of well-being in accord with self-appraisal of physical, emotional, spiritual status. Whereas in objective health, it is an absence of discernible disease, disability of defect, as measured by physical examination, laboratory test, and assessment by spiritual director or psychological counselor. Subjective health refers on how the persons evaluate their own health status. For example, if the nurse asks the patient what is her feeling right now, then the patient will respond na she's feeling ill, for example, kahit na the nurse is not sensing any complications. Kasi nga subjective, we can't judge the patient. Ibig sabihin, personal opinion niya yun. She is the only one who feels it. Pero dito sa objective health, malalaman mo kung nagsisinungaling or totoong nagsasabi yung pasyente. Kasi ito yung standard health because it is based on test, laboratory findings, and opinion ito ng professional who base rin sa scientific approach. So, moving on, under the meta-paradigm is the environment. It's not clearly defined here. She defined human condition and life experiences encountered by all men as sufferings, hope, pain, and illness. Gaya ng sinabi ko kanina, suffering is a feeling of displeasure or discomfort, which ranges from simple to extreme sufferings. Whereas itong hope, as what I've said earlier, it is the mainstream of this theory, to give hope, to have faith na gagaling yung pasyente. So, itong pain naman is not observable. Maaaring nakikita mo siyang nahihirapan, pero hindi mo matatansya kung gaano siya nasasaktan. Kasi nga, gaya ng sa sufferings, tanging yung tao lamang na nakakaranas ang nakakaramdam. Ito namang illness, gaya ng ating napag-aralan, ito yung pagiging irritable ng pasyente, being unhealthy sa palagay niya. Take note, itong apat na to, itong sufferings, hope, pain, and illness, tanging pasyente lamang ang nakakaramdam. Bagamat tayo ang nagbibigay ng hope sa pasyente, dapat maramdaman ito ng pasyente para maging epektibo. So, under din ng nursing meta-paradigms ay itong nursing itself. It is an interpersonal process whereby the professional nurse practitioner assists an individual, family, or community to prevent or cope with experiences or illnesses and sufferings, and if necessary, to find meaning in these experiences. As nursing defines by Travelbee, it is the most essential part of the paradigm. Nurses will help the patient to identify his or her suffering and later treat it, as the nurses are the ones who will employ a complete reasoning of why the patient suffers. So, tapos na tayo sa meta-paradigm. Ito na mismo yung theory. Description of theory. Travelbee believed that nursing is accomplished through human-to-human relationship that begin with the original encounter and then progress through stages of emerging identities, developing feelings of empathy, and later feelings of sympathy. So, pagkatapos ng sympathy, the nurse and patient attain a rapport in the final stage. For meeting the goals of nursing, it is a prerequisite to achieving a genuine human-to-human relationships. Itong human-to-human relationship can only establish by interaction process, gaya ng sinabi ko kanina. It has 5 phases. Una, the inaugural meeting or original encounter. Pangalawa, visibility of personal identities or emerging identities. Pangatlo, empathy. Pang-apat, sympathy. Panglima, establishing mutual understanding and contact or rapport. Even phases are product of interaction of a nurse towards its patient to develop human-to-human relationship. Series of interactional phases. Original encounter. First impression by the nurse of the sick person and vice versa. See each other in traditional roles. Emerging identities. Perceiving each other as a unique individuals. Empathy, described as the ability to share in the person's experience. Sympathy, happens when the nurse wishes to lessen the cause of the patient's sufferings. And finally, rapport, described as a nursing interventions that lessen the client's sufferings. The nurse and the patient are relating as human-to-human being, and they establish human-to-human relationship. I will elaborate these phases through this model. So, as you can see sa baba, the first level or the original encounter has a long gap. It is because there was this term stereotyping. It is assumptions or generalization in one particular group. As I mentioned earlier, the patient and nurses see each other in traditional roles, whereas nurses is to treat and patient is just to wait to be treated. There is no such connection here. Since this is the first time that they met, both of them are not that comfortable in talking and discussing deep thoughts and feelings. So, may kalayuan pa ang loob sa isa't isa. So, moving on, from there, we go up and see how this line goes a little bit shorter because this is the phase of emerging identities. At this time, the link of a relationship begins to form. The closeness of the patient and the nurse begins to establish. There is the contrast awareness that both have different thoughts and feelings. So this is the part wherein some nurses refuses to have, because some nurses are just on the first encounter and then they just give their treatment and that's it. They don't care on the patient as a whole, only on their illnesses. So human-to-human relationship is not being achieved. So sinabi ko nga na this is the part wherein some nurses refuses to have. Bakit ko nga ba nasabi? Kasi merong mga nurses, hindi ko nila lahat, pero may mga nurses na aminin natin parang robot na nakaprogram. Matapos i-assess ang pasyente, natambay na lamang sila sa nursing station na hindi nila masyadong tinitingnan o inaalam ang kalagayan ng pasyente. At marami yan dito sa probinsya. Kaya nga, minsan, hindi maintindihan ng pasyente kung ano yung sufferings, kung bakit siya binibigyan ng ganong treatment dahil hindi na ipaliwanag masyado, hindi alam kung saan ang gagaling, at kung bakit kailangan i-take niya ito para gumaling. Ito rin marahil ang dahilan why Miss Joyce Travelbee creates this theory to emphasize that human-to-human relationship is the purpose of nursing. So, maliban pa sa emerging identities, meron tayong empathy, developing feelings of empathy. The two qualities that enhances the empathy process are similarities of experiences and the desire to understand another person. Travelbee believes that the similarities of experiences will help nurse to understand the client's need. For example, age and gender similarities plays an essential part in these similarities because we have this girl's thing and boy's thing. Like for example, if a patient is complaining about dysmenorrhea, I'm not saying that a nurse who happens to be a boy are not effective on this illness, but what I'm trying to say is, it is more efficient if a girl nurse will assist because this is a type of gender that can only experience what the patient is going through. Hindi ito gender stereotyping para sa akin kasi that's the reality. Psychological state of experiencing, diba? Similarities in experiences. Hindi ito gender stereotyping ha. Hindi ito gender stereotyping ha. Pero kung ito yung stereotyping para sa inyo, pasensya na po. So, ito ngang empathy is trying to put yourself on the person who is experiencing the pain and sufferings. So, moving on, sympathy. It goes beyond empathy. This is again the intention of nurse to lessen the cause of sufferings. Feeling what others feeling, sharing emotional involvement, transforming sympathy into concrete actions. Kasi nga, dumaan na kayo sa original encounter, emerging identities at empathy, nandun na yung concern mo sa sympathy. Gusto mo nang malesen yung sufferings niya. Sympathy is not a phase in the process of knowing. It is rather a predisposition, a type of thinking and feeling characterized by deep personal interest and concern. Kasi nga, alam mo na yung pakiramdam and you put yourself on the shoes of the patient. So ngayon, gusto mo nang malaman kung ano bang magagawa mo para malesen yung pain. Concern ka na kasi may attachment na kayo eh. Nandun na yung drive mo na ma-aid yung patient and know what is the reason of his or her sufferings. So, both na kayo magbe-benefit sa isa't isa. Nurse is to fulfill the needs of patient and the patient fulfills the purpose of nursing. So, nandito na tayo sa last phase. The last phase or the final stage in achieving human-to-human relationship is the rapport. As you can see, both nurses and patient are on the circle. There is no gap. Getting to know another human being is as important as performing procedures. As noted, the nurses must establish a rapport. Otherwise, he or she will not know the patient's need. So, human-to-human relationship is achieved by means of this interactional process: original encounter, emerging identities, empathy, sympathy, and finally, rapport. So, in relationship pa rin sa rapport, according to Joyce Travelbee, A nurse is able to establish rapport because she possesses the necessary knowledge and skills required to assist ill persons because she is able to perceive, respond to, and appreciate the uniqueness of the ill human being. So, it is very essential to have this human-to-human relationship because it will give us the connection that is very vital in obtaining data and performing procedures to aid the sufferings.